Are there long-term risks with radiation therapy for prostate cancer? When considering radiation therapy for prostate cancer, many patients wonder about the long-term risks involved. Yes, there are some long-term risks associated with this treatment, but it is important to understand the context. Overall, serious complications are relatively low. However, some men may experience late side effects that can affect urinary, bowel, and sexual functions, which may arise years after the treatment. One key area to consider is urinary complications. Men who have moderate urinary side effects during radiation treatment are nearly twice as likely to develop chronic urinary issues later on. Long-term urinary problems can include difficulty urinating or urinary leakage. Interestingly, the risk of urinary complications after radiation is generally lower than after prostate surgery. For example, about 11% of men report urinary leakage 10 years after radiation, while higher rates are seen after surgery. Bowel complications are another concern. Radiation therapy is linked to a higher risk of serious bowel problems compared to surgery. Approximately 7 to 8% of men report significant bowel issues, such as rectal bleeding or bowel urgency, 10 years after treatment. Early bowel side effects during radiation can also predict a higher chance of chronic bowel problems later. Sexual dysfunction is also a potential side effect. While radiation can cause sexual issues, these tend to be less severe or less common than those experienced after prostatectomy. Over time, the differences in sexual function between radiation and surgery often diminish, with no significant differences noted at 10 years for men with high-risk cancer. Another important consideration is the increased risk of secondary cancers. Men treated with radiation have about a threefold increased risk of developing bladder cancer compared to untreated men over a 12-year period. This is a significant factor to keep in mind for long-term follow-up. Advancements in radiation techniques, such as smaller treatment margins and more precise delivery methods, aim to reduce early side effects and, in turn, lower the risk of long-term complications. Monitoring early side effects closely allows healthcare providers to make adjustments in treatment to improve long-term outcomes. While radiation therapy carries these risks, it is essential to note that prostate cancer treatments involve trade-offs. Surgery often has higher rates of urinary and sexual complications, while radiation tends to have higher bowel-related risks. Survival rates between these treatments are generally similar for many patients. In summary, radiation therapy for prostate cancer does come with long-term risks, particularly affecting urinary and bowel health, along with a slightly increased risk of secondary bladder cancer. However, these risks are generally manageable and are balanced against the benefits of effective cancer control. It is crucial for patients to discuss their individual risk factors and treatment options with their healthcare providers to make informed decisions tailored to their specific circumstances.